Support for First Coast Connect is provided in part by Baptist Health and North Florida TPO.
Good morning, I'm Ann Schindler, and this is First Coast Connect. Today, the health fight in Ukraine. We talked to a local doctor who just returned from a surgical mission to the war-torn nation about what he saw and what need remains. Later in the program, Jacksonville University launches a new sea turtle program, and local nonprofits brace for changes to city and state law. But first, as Russian attacks on Ukraine continue to intensify, local doctors are offering medical support. Here to tell us about it is Dr. Hudson Berrey, an orthopaedic oncologic surgeon from here in Jacksonville who recently returned from Ukraine. Dr. Berrey, thanks so much for being here.
Thanks for having me. Love to talk about this.
So, Dr. Berrey, you are a former colonel in the U.S. Army. You spent a lot of your career in the military, and you served as the chief of orthopedics at Walter Reed National Military Medical Center for a number of years. But most recently, you returned from working in Ukraine. Could you tell us what you went there for and a little bit about what you saw and experienced?
Well, the reason I go is because I look at this as an existential threat. It's an existential threat for Ukraine, but it's also an existential threat for the West, for freedom-loving countries who want to stay independent. And I have a feel in my heart for the Ukrainians. They have been, if you read their history, they've been stepped on throughout history. They've been occupied, and going back to, they had Greek cities on the southern banks of the northern banks of the Black Sea. But the reason I go is that Ukraine was emerging out of the shadow of their occupation by the Soviet Union, and they're somewhat limited in their healthcare settings. And part of the reason for Putin wanting to take over Ukraine was facing west to Europe and freedom and wanted and all that, which is
And NATO,
which is a real threat, but not so much NATO, I don't think, as it was, reorienting away from Moscow and to Western Europe. They have a young population, so I think that was the motivation that Putin had for attacking, and they have been overwhelmed with their casualties. They did not have the infrastructure, the manpower, the facilities to be able to deal with these, and it has escalated over the last 3 years after the full-scale invasion. I mean, the war has been going on since 2014. Actually, we only think about it in the last 3 years.
Sure, but with Crimea, it certainly dates back.
Crimea,
right?
The Little Green Men, and all of that, which was we are not blameless in the fall of Ukraine because we did not stand. There was accords that were signed, which the Ukrainians gave up their nuclear weapons for assurances of sovereignty, and that was signed by Russia, Ukraine, Britain, and us, and we just stood by when it came. So they have huge numbers of casualties. We've taught them a lot of things that have not been appropriate for the theater, and they.
You mean the surgical theater?
No, for the combat theater.
Uh-huh.
The combat theater, and we have what we call TCCC, which is Tactical Combat Casualty Care, and this is what we have used to take care of our wounded warriors for the last 50 years. But it was all developed when we had air superiority. We had control of the skies, and so we could, when somebody is wounded, we could get them from where they're the point of injury to an operating room in under 2 hours. So we used lots of tourniquets. We put them on, told them, the teaching was high and tight. So you get anywhere on your arm, you put a tourniquet high on your shoulder, or anywhere on the leg, you put one on there. But there, the evacuation times are measured in hours, if not days, because you have what they call the Russian double tap. Is if you have somebody injured, somebody's going to come after and get them, and then you can take those guys out too. So often evacuation has to wait until periods of darkness or poor visibility.
So people who are injured are waiting longer and it's taking longer to get them to assistance. And what does that mean from a surgical perspective, especially for somebody in your field who does largely, kind of focuses on amputations?
Well, actually, I ran an amputee service, and it's something I'm very good at. But you try to save the limbs. The biggest sequelae of this is that we end up with patients who have devastating wounds that are then dirty. The patients are dirty. There's often nutritional issues with them. They're older. I mean, the Ukrainian army average age is in the 30s because they've had such a population hit over the years that's the reason why their draft goes down to 26, so that the young men can start families and have children and then go and serve. Is that the right approach? I don't know. It's their choice. So, but the end result is that by the time the patients get back to the West, they end up with bad injuries that are infected with the bacteria that are resistant to antibiotics.
Mm-hmm.
So, and I've taken care of infections all my life in my role as what I call end stage orthopaedics. It's it's the last act of a desperate man, and that's the patients that end up on to me, and I enjoyed taking it as a challenge, so I got pretty good at it.
So I know that you sent some pictures of your recent time in the Ukraine. We're showing some of those. In Ukraine. We're showing some of those now, and so the surgery room that is something that you're working in. This is a training exercise, I guess, where people are working
That's correct.
not human
No
examples.
no.
Those
Well,
are animal examples.
yeah. So we have with the Med Global missions, we do what we call a resiliency medical mission, and this was started a number of years ago, and we we do a day of lectures, and then we do an animal lab day, and the lectures cover all of the topics that a surgeon would need to take care of an acute casualty, whether it's the heart, lung, kidneys, belly, burns, explosions, whatnot. And so that covers everything on day one, and then day two we'll have an animal lab that we use with pigs, because it'd be great if most of the time when we're doing this kind of training in the States, we do it with cadaver training, but you can't do that with Ukraine. And from an anatomic point of view, a pig is from the neck to the pelvis is pretty much the same as the inside as we are.
So you're training people to work in this difficult setting, and so you're showing them some techniques, but I would guess that the pace and the intensity is also something that you have to try to prepare physicians for, and it's something that you've experienced. Can you just tell us a little bit about what it's like to be working in conditions where there is active fighting, where there is mass casualties, and round the clock treatments?
Yeah, it's and this comes down to the heart of the issue I think that we have there, is that why do we have such an issue with infections there? Is it because there is inadequate initial treatment of the injuries? You have to be very aggressive when you're debriding or removing dead or damaged tissue at the very beginning. Is it because they're not washed out enough? Is it because of the time it takes to get them from their initial point of injury to where the stabilization point, which is where they get their initial care, and then further back it's the Ukraine is like the state of Texas in size.
Mm-hmm.
So to go from the east to the west is a 24-hour train ride. I mean, it's there's stops along the way. Is it resource issues? Is it training issues? Is it time issues? All of these, is it really a combination of all of these? I mean, I've done a couple of mass cows in my life with, so in the Desert Storm, we had our hospital in Saudi Arabia took care of the injured from a Scud attack when the missile went through the barracks and exploded in the barracks, and we were busy all night with that. And that really taught you the principles of that we have for mass casualties, the triage, the sorting, and it's something we had practiced on a number of times, and it worked exceptionally well.
I would guess, though, just at a human and kind of a visceral level, it must be extraordinarily difficult.
It was. It's a hard. It's one of those memories that you kind of keep locked back in the back of your head. So we did end up losing 3 kids that night, and I think so when you have triage, you have to, allocate your resources, so you can't save everybody. You don't have all the time, people, and everything else.
But more than 70 people did survive
Oh, yeah.
because of the care you
Oh, yeah.
provided. I mean, there was
we had and it was the following morning as I was walking out of the hospital as the sun was coming up as we'd finished in the OR, and it was just kind of a sense of satisfaction and thanks that we were able to do the job we did. I'd been in El Salvador as an advisor in the mid '80s, and that was during the World Cup of 1986, and in the rest of the world, not the United States so much, but in the rest of the world stops during the World Cup. It's just, and the war stopped for the 2 weeks of the World Cup.
Is that right?
And then the finals were on Sunday, and then bright and early Monday morning, one of the El Salvadoran Armed Forces barracks got hit by the rebels, and we had a mass cal that day. And then
Am I correct in understanding that soccer was actually a tool that you used with some patients to kind of motivate them to recover a little faster?
Yeah, it's a wonderful sport is a wonderful thing to get people up and moving. I think it's a critical part of rehabilitation. Brooks Hospital here has a wonderful challenged athlete program. And they're nationally competitive. So there we had, again, a lot of amputees because they had homemade mines that guys would be stepping on and blowing off their foot, and so they had a lot of amputees. So we developed an amputee soccer program. So the guys would be on crutches in the field, and the goalies had to be an upper extremity amputee. And they would get into it so much that they would try to kick the ball with their missing leg and fall down in a heap, and everybody would laugh at them, and it was all good fun. But they brought the team to the States and played another soccer team. So.
And you set it up so that the players on the field had to have a lower extremity amputation, and the goalkeepers had to have an upper extremity,
Correct.
just to kind of force them into that.
Yep.
Yeah.
Yep. And it's. It's the camaraderie. It's you quit feeling sorry for yourself. And my attitude for amputees is that they're not disabled. I call them they're differently abled.
Mm-hmm.
Because the fastest man in the world is a bilateral lower extremity amputee, running on what they call blades, because they have spring to them, and you can go.
Make some time.
Yeah.
You have served. You've served on the USS Mercy.
Yep.
You have done work like you did in Ukraine, in Haiti and
Yep.
Peru, Vietnam, the Philippines. really, and then also in U.S. wartime in Iraq and Afghanistan. And so you have done a lot of this work. How is the work of amputation perhaps different than we think of? I mean, I think a lot of us think of, wartime amputation as a fairly,
Grizzly.
yeah, and perhaps not so precise and not so, you know, uh, careful that it's being done quickly. It's being done out of urgency and maybe without a great deal of care.
Well, you do what you're taught, and so and it's part of what because I have a whole lecture on amputation surgery and the ways and it's excuse me, the the it's not operation of failure. It is it's a rehabilitation operation. So it's to give the patient their life back, because sometimes what you're trying to save is not worth the cost, because you say, yes, it looks like a leg, but it doesn't work like a leg. It's painful, it hurt. We have wonderful ways of being able to salvage an extremity. And we can grow bone, we can make bones longer. We've got flaps, we've got, free flaps, tissue coverage. We have all of these wonderful techniques. But at the end of the whole process is what we have provided the patient. Is it better than a well-done amputation and a modern prosthesis? I mean, I've been lucky here in Jacksonville that I had probably one of the best prosthetists that I've ever worked with, a fellow by the name of Mike Richardson, and we worked very closely together. And it's not just about the surgery; it's about the patient. So I would have patients sent to me that had an injury that impaired their ability to do what they want to do. And instead, when we talked about the options, I told them I couldn't tell them what being an amputee is like. So I sent them over to Mike, and he would do it. And you often talk about, because of his patients, hook them up with a patient of the same sex, same age, and whatnot.
Mm.
And then by the time they come back to me, he says, "Yeah, all right, let's go. I'm ready for this. I'm ready to move on with my life."
I mean, I've seen you say that people can end up, I think you say, prisoners to their legs.
Yeah.
Why is that?
Well, I think some of this is the ego of the surgeons. Nobody knows what it's like to be an amputee. You look at it and says, "Oh my God, you've lost. Your life is over with," and everything. And that is absolutely not the case. Your quality of life can be vastly improved with a well-done amputation if you have something with your leg that is keeping you from enjoying your life. We had one patient who had this bad nerve problem with his leg, hadn't been out of the house in like 25 years other than to go with his wife to Walmart, and he would stay in the car.
Because of the pain?
Because of his pain and his dysfunction and all. And so his wife worked with us in the OR, and so she asked if I would see him because he'd been on so much pain medicine that we didn't detox him well. It was our bad. But after he got over that, he had a great quality of life with that. So
because you went ahead and did amputation?
Yeah.
Yeah.
I had one fellow who was training for the Beijing Olympics who was working at a job and had his foot crushed, and they saved his foot and all, but it kept him from being able to do what he loved to do, which was martial arts. So he got sent to me, and we did his amputation, and he had an exceptional result with that, and ended up on American Ninja Warriors.
Oh my goodness.
So
I would say that's some mobility.
So, and he wasn't successful, but it wasn't because of his legs. It's because of his upper body strength.
Uh-huh.
And he fell off the rings or into the pool of water or whatnot. So, but we have modern techniques that we can salvage things that look like legs but don't work like legs,
Mm-hmm.
don't work like feet. They can be stiff, they can be painful. And when you have a well-done amputation, it can be a significant improvement.
Well, Dr. Hudson Berrey, thank you for the work that you've done.
Sure.
Thank you for the work that you continue to do, and appreciate you being here this morning to tell us about it.
Great. Love it. I'll keep going back as long as I'm able, you know.
Retire again?
No, you spend 40 years doing this, and then you can't just retire and put it on a shelf. So you have to try to continue to find ways of giving back, and that's what I'm trying to do.
Well, we appreciate it, Dr. Hudson Berrey. Up next, local nonprofits respond to a rapidly changing political and financial landscape. Welcome back. Well, running a nonprofit has never been easy, but the task has gotten decidedly more challenging in recent years. Here to talk about navigating the challenges is Dawn Lockhart. She is the CEO of the Nonprofit Center of Northeast Florida. Good morning, Dawn.
Good morning.
Thanks for being here.
My pleasure. Thank you.
So, I want to talk to you about the challenge of running a nonprofit because your organization has recently done a sort of post-COVID assessment of, what that pandemic introduced in terms of, all kinds of changes, and then also sort of how it's changed how people regard nonprofits. I'm interested in sort of your big takeaways from what that report told you about how things are changing.
Well, certainly nonprofit leadership is a challenge no matter the time, whether it's the pandemic, the recession, or the current moment. But nonprofit organizations are accustomed to thinking through the challenges. They're delivering on services every day, and they have a board of directors that's focused on helping them to mitigate that. But one of the things that is important for the sector to think about is really focusing on diversity of revenue so that as revenue streams adjust or the market conditions change, they have the capacity to still continue to deliver on their mission and to deliver the critical services that the community needs for our community.
You mentioned the Great Recession, and obviously that was a period where nonprofits took a real hit just in terms of the money that they were bringing in. And that's because people often didn't have the same money to spend
Right.
or perhaps didn't feel comfortable spending as much.
Right.
And then you have COVID, which in some ways actually brought in an enormous amount of new money
Right.
to a lot of nonprofits, which is not a terrible thing for most nonprofits, but it changed the way some of them operate. It sort of changed financial expectations. And in most cases, that money has dissipated or gone away entirely.
It has. So during the pandemic, there was an incredible infusion of resources to support nonprofit organizations that were delivering critical, essential services for our community. During the pandemic, there was so much demand for the organizations that were delivering those services, and the resources were just not there. So fortunately, government provided critical funding to make sure that nonprofits were sustainable and resilient in response to that. Something that's interesting is in North Florida, the workforce of nonprofits totals about 78,000. We have currently almost 7,000 nonprofits, of which about 1,400 of them are large organizations, large enough that they actually file a 990, which is our tax return. So we know from those organizations that 1/3 of them prior to 2025 were in the red, and 35% of them did not have any reserves.
Wow.
So you think about the challenges of navigating increased demand and a reduction in funding. Eventually, the bubble under the rug bursts, And that's really the moment that we're in right now is how do we think about navigating a difficult, financially constrained environment? And what does the board of directors, the trustees who have pledged their commitment to leading those organizations do to think about the sustainability of the missions that these organizations are responsible for?
And so that's the reality that, organizations were facing, having this money in some cases pulled back. So, operating at a deficit, as many as a third of them. And yet we are now moving into a whole new era of, apparent pullback, whether it's government financing for nonprofits, whether it's funding for the arts or funding for, um, you know, kind of humanitarian type causes, a variety of things that it appears that, kind of the current thinking nationally and at the state level is sort of even retracting further.
Right.
So it's sort of a double whammy.
It's probably a quadruple whammy. Many times, especially nonprofit organizations that receive government funding, and here in North Florida, we know that there are 22% of the nonprofit organizations that receive government funding. So think about the ramification of this number I'm about to share. 22% of the organizations have been appropriated $734 million, federal, state, and local, of which 75% of that is at risk right now.
Wow.
That is going to shock the ecosystem of the sector in ways that we haven't seen before. The demands aren't going to stop. Nonprofits, when funding gets turned off, you mentioned earlier about the pandemic and CARES Act funding. We know that CARES Act funding from 2022 through 2024 has been frozen. So nonprofit organizations who have counted on those dollars to be in their budget to reimburse them for services that they've already been providing may not come to be. So they're now having to think about how do we navigate through this and not depend on this resource while the services are continuing to be in demand and the expectations of high quality care must continue.
So your organization is a resource for nonprofits. Broadly speaking, you don't provide an aid particularly yourself. You're an organizational resource. So what are you telling people, especially when I would imagine you have a lot of people who are now kind of all in this same boat, looking at a shrinking pile of resources and, panicking, I would guess.
A couple of things. First of all, we are really advocating for boards of directors, trustees, the civic leadership in this community to really pay attention to their fiduciary, legal, and moral responsibility that they committed when they pledged to serve the missions of their organizations. Now is the time to step up, to evaluate what the revenue risk is for the organization, to make sure that if there is a particular source of funding that is not dependable at this point, what is the response going to be? And what are the focuses going to be? Do we need to retract our services? Do we need to focus on our core mission? Is it possible that organizations might need to merge or align? There are many different things that an organization can do. One of the things that the Nonprofit Center is doing, and you're right, while we don't deliver direct service to individuals, we do take very serious responsibility for increasing the capacity of the organizations who are our members so that they can increase the support and services to their beneficiaries. And so we've launched a couple of new initiatives. We've launched a Catalyst website that provides real-time data for organizations to be able to navigate and understand what's happening, and then bringing them together so that they can develop shared vision and partnership around the programs that they're delivering. We're moving forward with an initiative to focus on shared services, where we can provide nonprofit organizations with fractional executives, back office support like human resources and technology and accounting, marketing, all those things that may not be as exciting to invest in, but are critical for a high-functioning organization so that they can then focus more on the front end. And then the last thing we're doing in October, we are bringing in a couple of national experts around mergers and acquisitions to introduce to the community the opportunity for, if in fact a merger is the right solution for you, and it isn't the right solution for everyone, but if it is the right one, what's the best way to do that? And how can we help them navigate that?
If you're just joining us, we are talking to Dawn Lockhart about the challenges that nonprofits are facing in the current environment. If you run a nonprofit or sit on a board, we would love to hear from you. Give us a call at 904-549-2937. You can email comments or questions to First Coast Connect at WJCT.org, or you can reach out on social media. Um, we're in a little bit, we're going to be talking to Jacksonville University about a new sea turtle program that they are unveiling for students. But in the meantime, I want to ask you about that idea of merging
Mhm.
because there are sometimes criticisms of the nonprofit community that it's duplicative, that, there's too many in the space. And I wonder what your thoughts are about whether, while it wouldn't obviously be the goal of any nonprofit to fold or merge or, kind of create a joint mission with another one, um, whether that's an opportunity. Do you think that that's something that could actually strengthen nonprofits overall, or do you see that as a compromise that must be made just to kind of endure?
It depends on the mission and the revenue streams and the culture of the organization, just like in the private sector. Culture eats strategy all the time. So I think it's really if it's the right fit. And I think that there is this perception in the community that nonprofits duplicate each other. It's not true. An organization that is serving families in a neighborhood is also not another organization is also not serving that same family with the same meal or healthcare services in another neighborhood. And so while there are like organizations that deliver common services, they are not duplicating the delivery of the service to the individual. But that right there is an opportunity for how do those organizations think about aligning, whether it's through collaboration and strategic partnerships, or it's emerging. And that's really where our Catalyst work is focusing. We have some exciting conversations happening. And for example, in our youth and education cohort, we have nearly 80 nonprofit organizations who are coming around the table to find how they can crosswalk the impact of the work that they're doing together. What I anticipate happening is that there might be some interesting opportunities for some organizations to say, we're already working together this closely. Maybe we can find some ways to streamline. And so I think it'll be a natural process. And when that opportunity comes up, we want to be there to be able to provide those resources.
And so how do those conversations start? I mean, if there are a couple of nonprofits in town that, maybe have some synergies or similarities, are they open to kind of initiating those conversations, or is that seen as sort of a concession that they don't want
Oh,
to?
very, very much open. Honestly, it is typically the boards of directors that stand in the way.
Huh.
Yeah.
And why is that?
I think, there's board leadership has a lot of opportunity to drive strategy for the missions, and many times they are very personally connected to the success of that organization. And I think how we can really galvanize the civic leadership in our community to understand that one organization, another organization, one plus one could actually equal six, and the impact could be quadrupled. So it's getting the right fit, getting the right message. But again, it's not the right solution for everybody. But certainly, there are going to need to be some reform that happens, and there's some reform that needs to happen also within nonprofit organizations themselves. Right now, as an organization that is getting funding cut, they really need to recognize that if they don't have the funds to deliver the service, they're not going to be able to deliver it for free. And so we have to make those hard choices
Yeah.
to ensure we're continuing.
I want to ask you about something that's been in the news, which is a city council bill that was recently approved by the council. It has not yet been signed by the mayor, and there's some question as to whether she is going to sign it. It doesn't appear that there are enough votes to override a veto if she chooses to veto it. But basically, this is the bill that would require, basically says the city can't pay for services for undocumented immigrants, people who don't have proper documentation, who live in Jacksonville. And the onus would essentially fall on a provider, a nonprofit agency that contracts with the city to provide some kind of service to say, we are or are not, allowing this money to get to people who don't have documentation. What are you hearing from your membership or from the nonprofit community about how this could, how they might manage this?
So Because the mayor hasn't yet decided what she's going to do, we don't know what the outcome of that will be. When that is decided, the Nonprofit Center will certainly work with the administration and our members to help them figure out, one, how to be in compliance with the law, but more importantly, how to make sure they can continue to deliver the services to vulnerable populations. And many nonprofit organizations deliver services to the immigrant community, and nonprofits are independent 501c3s, so they are autonomous. They have the capacity to make decisions around who they're going to serve and when they're going to serve them. And so we'll work with those organizations to help them develop ideas and mechanisms to make sure that they can meet their missions.
And who are you thinking of when you say these are groups that are serving, in some cases, community members that are immigrant, some of them undocumented? What kind of agencies are doing that kind of work?
All organizations, the arts community, the human services community, the faith-based community, there are all different types of nonprofit organizations that are delivering services to vulnerable populations. So it's going to take all of us thinking about how to be creative to make sure that individuals who are coming to an organization in need get the services that they deserve to receive. And it's going to be up to the boards of directors to make sure that those resources are available to make sure that happens.
And so I hear you saying, the mayor hasn't signed it and we won't know the impacts until that happens. And yet I'm curious what concerns you're hearing from your membership, and if any of them are reaching out, if they're, appealing to the mayor or urging one way or another on this bill.
I really can't speak specifically to which particular organization is in fact advocating. I know that there are organizations who have had funding cuts for the delivery of services that they have been providing, or they're no longer in a position to provide those services. So I think this is a gradual process that we're looking at right now to determine how we as a community are going to step up and serve the families.
Is there something functionally obsolete about the structure of nonprofits?
Yes. The sector model, honestly, is a broken model. It's not for not trying. It's not for not making sure that we are delivering important services, but it is literally impossible for nonprofit organizations who are experiencing the same challenges that the private sector is delivering. We have labor challenges. We can't recruit and retain talent because we're not providing competitive wages. We have the same increase in costs that all organizations are providing. So I'm really trying to look at this moment as an opportunity for reform, to think about what is it we need to do to make sure that the sector that provides the quality of life in this community that we all enjoy. Nonprofits provide support for joy and youth and health, um, arts, culture, or healthcare, or human services and counseling, arts and parks. Those are things that we all enjoy. But the mechanism for how these organizations are supported needs to change.
Well, Dawn Lockhart, it is great to talk to you. And I know this is a conversation we'll be continuing to have, particularly over the next year. So thank you so much for being here today.
Thank you so much.
All right. Up next, Jacksonville University unveils a new program researching one of the state's most iconic species. Welcome back. Jacksonville University unveiled a new program yesterday on World Sea Turtle Day, appropriately enough. And here to tell us about the launch of JU's fledgling sea turtle program is its director, Lucas Meers. Good morning, Lucas.
Good morning, Ann. How are you?
I'm great. Thank you for being here. We're also
For having
joined
me.
by Dr. Bryan. He's the executive director of the school's Marine Science Research Institute. Good morning.
Good morning.
So Jacksonville University unveiled the Sea Turtle program. It's something very close to your heart, Lucas, in part because you're a former student at JU, but also because after graduating, you went and worked with the partner organization on this, the Mickler's Sea Turtle Patrol.
Yes. So after graduation, I started volunteering with Mickler Sea Turtle Patrol. And I've been with them for 15 years. In 2021, I took over the permit, took over the coordination of the volunteer group. And I was searching for a home for the program for the past couple of years. And after we solidified some funding, I reached out to JU, was my first choice because it was my home away from home. I knew all the professors. I took the very first class when the MSRI opened in 2009, 2010. So it's great to be back home.
Bryan, what is this program? I mean, that was announced. Who is going to be a part of it? What does it offer students?
Yeah, so, it was a great opportunity for us to bring Lucas home and bring this program to JU. And, it is an area that traditionally we haven't really had much of an impact in the sea turtle kind of space. So it really just aligned very well for us, and it allows our students and our faculty to have these opportunities, these educational as well as research opportunities to gain that real world experience doing scientific research, collecting, robust data that can be used to conserve these species. So for us, it really provided a new opportunity for our students to get involved in a species that, is one of those charismatic species that we care about and is critically important for our oceans.
And it is an expansion of an existing and a robust program that you have in terms of the marine science research. You've got a beautiful building on the St. Johns River. You've got kind of a bunch of labs, a partnership, and sometimes with the river keeper. And so you've got a good program, a very solid program, but this adds something essential.
Yeah, I mean, it adds a new component for us. For us, our mission is to provide educational opportunities for our students, research opportunities, and then also building those connections within the community. And this program really hits all of that for us and allows us to expand what we do, and leverage our relationships, our expertise, our students to provide that positive impact for the community as well as for our students.
Lucas, how large of a program is this going to be?
That I don't know. I think the world is our oyster. I would love, right now we have 6 students involved, 6 JU students, both bachelor's and master's students, going out and collecting data and doing some outreach programs with some local schools, public schools. But I hope to have a lot more students involved in the coming years, answering a lot more questions, students that have questions, exploring those questions, the scientific process, and going out there and collecting data themselves. So I really hope to have several more students involved in the program in the coming years.
And the group that you're partnering with, I mean, they are basically in charge, this group that you've been involved with patrolling the beach. They do it daily during nesting season. Is that right?
Exactly. So we do it, Mickler's Landing Turtle Patrol patrols the beach every single morning, 200 days a year from April 15th through October 31st during the sea turtle nesting season, looking for any new nests and monitoring the existing nests. And we're collecting all of this data to really understand the population of sea turtles in Florida. We're also using this data to influence any beach renourishment projects, when and how they can do that, or any additional beach construction projects for beachfront homeowners to see their impact on sea turtle nesting.
I'm talking to Lucas Meers and Dr. Bryan Franks about JU's new Sea Turtle program. We're going to take a short break. We'll be back with more in just 2 minutes.
Museum of Science and History's new exhibition, Mosh Archives, The Story of Us and You, steps you into a treasure trove of memories, now through August 31st. Tickets and information at themosh.org. Tidbits, family owned and operated since 1985, offers dine-in, catering, delivery, and takeout at Bay Meadows, Hendricks, and Mandarin locations. Menu items include fresh sandwiches, salads, and soups, open Monday through Saturday. Online ordering and menu at clarastidbits.com.
The $2.4 trillion One Big Beautiful Bill Act marks a big shift in Republican tax policy. That's according to many conservative economists.
Now the overall balance is to really carve up the tax system, spend a lot on temporary targeted tax cuts, and not have a very meaningful impact on growth.
That's on the next On Point.
Today at 11 on WJCT News 89.9.
Overdose deaths in 2024 fell to their lowest level since before the pandemic. That's according to new CDC numbers. One factor, the wider availability of the overdose reversal drug naloxone. But addiction experts warn the crisis is far from over as the Trump administration eyes cutting addiction treatment programs. Where the U.S. stands in its fight against the opioid epidemic. Next time on 1A.
Today starting at 10 on WJCT News 89.9.
Welcome back. If you're just joining us, I am talking to Lucas Meers and Dr. Bryan Franks about Jacksonville University's brand new sea turtle program. I want to start by asking you, Lucas, I mean, this Mickler's program, we should say, is associated with Mickler's Landing in Ponte Vedra, and the beach patrol that you have participated in over the last several years, almost 5 miles of kind of Ponte Vedra Beach. How busy of a place is that when it comes to patrolling for sea turtle nests?
Compared to the rest of Florida, we have what we call a low-density beach. But in Northeast Florida, we have a relatively high nesting density. We average about 100 to 120 nests per year. Our highest nesting year was 2022 and 2019 at 184 nests along our 4.5, 5 mile stretch of beach. But we do provide those opportunities. There is enough nests for students to actually experience and do a lot of the nest marking and data collection.
And so the patrols go out and they are keeping an eye out for when there's kind of a crawl. You can see the turtles have come up from the ocean and either tried or perhaps, tried and failed to lay eggs. So that's something that the patrol monitors keep track of. What are the students going to be doing?
Correct. So our team, which the students are on our team, we have a team of community volunteers and JU students that are walking the beach 30 minutes before sunrise along the most recent high tide line. And we're looking for those turtle tracks that are exiting the water or the most recent high tide line and going up to the dune. And we can identify the species based on the track pattern, and we can identify what she did in the sand based on the clues that she left behind. And so we're collecting data, not only the nest numbers, the number of nests, but also how successful those nests are. So when those nests eventually hatch, we're collecting that. We do a nest productivity assessment, is what it's scientifically called. We call it a nest evaluation. It's a little bit of a softer term, where we count how many eggs hatch and how many didn't hatch, and then we get the success rate of that nest. Because it's not only important to know how many nests we have on the beach and what species, but it's important to know how successful those nests are. How many hatchlings are each nest producing?
And so you can track by looking at the eggs how many have hatched, but is that truly a measure of success? I feel like a lot of times you have, nesting turtles, they hatch and then they go through the dunes and they're heading in the wrong direction and they don't make it, or they get picked off by, a predator or a human in some way.
Yeah, we estimate that 1 or 2 out of every 1,000 hatchlings make it to reproductive maturity, which can happen anywhere between 17 and 35 years. And so we do use that as a little bit of a proxy to understand what's going on. We can't determine the exact population of sea turtles, but based on trends over several years, sometimes over decades, we can kind of get an understanding of what's going on with the population of sea turtles.
And what are we seeing?
For Florida overall, we're seeing a relatively stable population for loggerheads. In Northeast Florida, we are seeing a little bit of an increase. There was just a massive study done a couple of months ago that was just published, I think in February, where they did an analysis of all the major sea turtle populations around the world, and a little bit more than 50% of the sea turtle populations around the world are increasing in number. There are some that are still struggling due to several factors, particularly in remote areas, sometimes due to poaching or any other climate change and sea level rise. But overall in Florida, we seem to see the population is relatively stable.
So, Bryan, I mentioned that this was sort of announced yesterday on National Sea Turtle Day, but what is the school doing to kind of promote this or let students or potential students know that it's available?
Yeah, so, it is relatively new. As you said, we launched it yesterday. Lucas came on board 5-6 months ago, and this is really the first nesting season where we've had this partnership. And very quickly, as Lucas mentioned, we already have students involved. And, Lucas can provide his expertise in our courses, coming to speak to our students about sea turtles. And that's really the first connection that a lot of our students have. But most of our students already know about this, are very excited about this. And I continue to see that growth. We are seeing growth across marine science at JU, which is very exciting for us. And this is just another opportunity for students to get involved, and really they are hitting the ground running. Lucas already has students working on the patrols, but then we also have a couple of our students working on independent studies where they're going to be working on specific small portions of the research just themselves, so they can take some ownership of that and get that experience of conducting firsthand research. But really, making that widely known to our students, to be honest, they do a lot of that themselves.
Really?
By talking amongst each other and getting excited. We have a sea turtle program. I can do sea turtle research. And again, being that charismatic species, with our dolphin work that we do and the shark work that we do,
Yeah.
this is just another component for us.
Sure. I mean, some ways those programs kind of sell themselves.
Hmm.
Yeah.
Hmm.
Well, Lucas Meers, Dr. Bryan Franks, it's great to have you on. Good luck with the program. I'm sure we'll be keeping current on it as it progresses. But thanks so much for being
Thanks
here
so
today.
much. Appreciate
All
it.
right. Thank you for listening. That's our program. If you have comments, suggestions, or questions, you can send it to First Coast Connect. You can send any of them to First Coast Connect at WJCT.org. If you missed anything, you can catch our rebroadcast at 8 o'clock tonight, or you can find our entire archive on your favorite podcast platform or at WJCT.org. The executive producer of First Coast Connect is David Luckin. Our show is produced by Stacey Bennett and directed by Brady Corum. Our music is performed by Club de Belugas. Please join us tomorrow. We're going to be asking 3 local bookstore owners for everything from best summertime beach books to rainy day must-reads. I'm Ann Schindler. You've been listening to First Coast Connect on WJCT.
Coast Connect is provided by Baptist Health and the North Florida TPO.
Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com. The North Florida TPO is dedicated to transportation planning, funding, clean fuels, and new technologies for a vibrant, resilient, and connected region. More information available at northfloridatpo.com. Museum of Science and History's new exhibition, Mosh Archives, the story of us and you, steps you into a treasure trove of memories now through August 31st. Tickets and information at themosh.org.